Welcome back to the ACS Brief, Surgeons' Voices from the Front Lines. With me today is a return guest, my friend Dr. John Stewart. Dr. Stewart is the director of the Louisiana Children's Medical Center at Louisiana State University. And for the purpose of today's conversation, he is also the chair of the Advisory Council Chairs at the ACS. Welcome back, John.
Thank you for having me.
It's a pleasure to have you back. The strategic plan of the college, formed by the regents and others, addresses several groups of people. The Advisory Council, of course, is one of the groups who directly interfaces with individuals, our fellows and members from around the world in all different stages of practice and all different types of practice. Can you tell us about some of the initiatives reaching out in these areas, perhaps starting out with the specialty surgeons?
Yes, and so there are three areas that we seek to target during the coming year in the execution of our strategic plan. That includes our international colleagues, that includes the residents, and that includes the specialty colleagues. And so let's start with the international colleagues. We know that learning and making sure that we fortify the house of surgery is a two-way street. And so we want to make sure that we engage our international colleagues so that we can learn from their experiences in their countries, but also as an effort for consistent outreach. And so when I think about the Advisory Council's roles, we're planning to have international distance learning between the United States and our international colleagues around important areas such as cardiothoracic surgery, orthopedic surgery, and general surgery. We think that this will allow us to spread our influence throughout the world and also bring in colleagues from areas that might not otherwise have exposure to the college. The second area is that of reaching out to our residents. We have enacted a program in which residents from general surgery programs or surgery programs in general can become associated with the college as resident members for no additional fees. That's an important motive, again, because the young surgeons and the residents are the lifeblood of the American College of Surgeons, and it is incumbent upon us to allow them to understand the benefit of having a viable college. The third aspect is reaching out to our specialty colleagues. When Scott Levin was the chair of the Board of Regents, it was important to him to make sure that we broadened the tent in the House of Surgery. Scott is an orthopedic surgeon, more specifically a hand surgeon, and he wanted to make sure that his colleagues in orthopedics, hand surgery, as well as neurosurgery, ophthalmology, and urology, and gynecology, among others, have a strong presence in the college to make sure that we're disseminating information that will improve the House of Surgery standing in society.
Fantastic. Well, you very succinctly and comprehensively covered the three important areas that we're thinking about: specialty engagement, resident engagement, and international surgeon engagement. So you also mentioned communication and getting things to people. So not everybody may understand the role of the Advisory Council for dissemination of that information. How is it done?
And so we have advisory councils for a variety of specialties. And what we have done is that we have made sure that the advisory councils serve as hubs through our quarterly newsletters to disseminate information to the advisory council members. Now, with respect to disseminating information to the general college membership, advisory councils submit articles of interest for the bulletin brief that highlights recent developments in their specialties or issues of historic importance. And so we, again, maintain constant communication with our general surgery and surgical subspecialty colleagues.
Perhaps you could also discuss a little bit the role of the advisory councils in the annual clinical congress.
Sure. And so there are a number of important roles that the advisory councils play. So I think first and foremost is that of helping build the program with the program committee. And so members of the advisory councils submit abstracts and ideas for not only panel sessions, but also meet the professor sessions and town halls and so on. And those suggestions are reviewed by the program committee to, again, help build our program for the clinical congress.
Great. So that's a very important function. And is that something that would be done by one advisory council, or do you tend to encourage interdisciplinary and interspecialty collaboration on programs?
Yes, yes. And so that's a great point. And hats off to the governors, Board of Governors, as they have sought to expand the interdisciplinary submissions to the Clinical Congress. And so, for instance, very soon we will have a virtual meeting with the advisory councils and the Board of Governors so that we can, as well as other committees such as the COT and the COC, to make sure that we have discussions about issues that are important across the disciplines to improve patient care and safety.
That's great. How about medical students? Are there any programs that are outreach? You mentioned residents, certainly. Does it go down as far as medical students? Yes,
it does go down as far as medical students, and we encourage all of our programs to make sure that they include medical students in the local programming of the college.
Well, that's great. So there's a certain, in terms of local programming, there's a certain overlap with the chapters then. And is there any official relationship, or is it ad hoc?
Well, I know that the students have the opportunity to join as associate members, but at the local level, there are opportunities for them to participate kind of in chapter functions, such as, I think back to my previous experience in North Carolina, where we had the trauma forum, in which students can work with residents and fellows and attendings to create presentations for that forum.
Well, thanks very much. You've given us a wealth of information, and it's nice to get a glimpse into the working of the Advisory Council. Certainly very many important contributions to the fellows and residents and medical students. So
great.
Thanks for your time today, Dr. Stewart.
All right. Thank you. It's good to see you.
And thanks for all you do. Good to see you too.
All right. Bye-bye.